are going to lose their coverage, and many more could see their costs go up by as much as 75%. And that's on top of the most recent inflation data that shows our economy is headed in the wrong direction. And despite those numbers, everything that we've seen from this administration, from its tariff policy raising prices on cars to coffee, to the passage of the one big, beautiful bill, or betrayal, as I call it, that ripped Medicaid away from millions of Americans to finance tax breaks for billionaires. All of those actions has made the affordability crisis for average Americans worse. For far too many American families, this growing affordability crisis includes the rising cost of health care. We in Congress must not let these concerns go unanswered, especially when we have the ability to act. And we have the solution to prevent health care costs from skyrocketing even further overnight. That's why a number of my colleagues and I have worked in the Senate to introduce bicameral legislation that would permanently extend the enhanced premium tax credits, those benefits that allow so many Americans, our neighbors, our small businesses, our friends, who rely on that help to keep their premium costs low to be able to afford health insurance. Extending the tax credits has been a priority, and we've been calling attention to the looming expiration of these vital tax credits since last year. In fact, 3 times during this past year, my Democratic colleagues and I have tried to pass our legislation to offer some real relief to working families grappling with the high cost of living. Unfortunately, our colleagues on the other side of the aisle have blocked each and every one of these efforts. Now, this program, to provide that help that families need to cover their cost of health insurance, this program is set to expire at the end of the year, and there's no plan in sight to replace it and to help families afford health insurance. Allowing these tax credits to expire is going to harm the record enrollment in the ACA marketplace that so many people have worked so hard to achieve. And this past year has been record enrollment in the ACA. Now, what does it mean for Americans if we allow these tax credits to expire? It means that 24 million Americans will see their health insurance costs go up. It means that 4 million Americans could lose their coverage entirely. And that's not an exaggeration, because that's based on the nonpartisan data from the Congressional Budget Office. Now, according to a report that a number of us commissioned from the Georgetown Center on Health Insurance Reforms, eliminating these tax credits will disproportionately hurt older people, those who live in rural areas, and small business owners, those people who can least afford to pay additional costs for their health insurance. On average, marketplace premiums will rise by 75%, roughly $700 a year. That's the biggest increase in over a decade. And this price increase affects the very people who can least afford rising costs right now. I spoke with one of my constituents last week, Paul from Canaan. Canaan is a small town in the northern part of New Hampshire. He's one of those people who we talk about, who Georgetown University Center talked about when they talked about the impact of those cost increases on Americans. Paul's employer-sponsored insurance would be prohibitively expensive for him and his family. And it's not only that, it's not accepted by a lot of the providers in his area. His wife also has an autoimmune disease, and his son needs insurance coverage in order to attend the University of New Hampshire. So that means that those enhanced premium tax credits, the benefits that we provided in Congress to ensure that families like Paul's could afford their health insurance, they have been a lifeline for him. He told me that thanks to the credits, he no longer fears that one single emergency room visit could bankrupt his family. But sadly, without those enhanced premium tax credits, not only Paul, but millions of Americans will have to make difficult choices about what they can live without so they can afford health insurance. That should be unacceptable to all of us in the United States of America. The American people are rightfully concerned about the soaring costs of health care coverage, and they're looking to Congress. They're asking us to work together to get this done. I'm here to remind all of our colleagues, along with Senator Welch and those of us who are speaking to this, but mostly our Republican colleagues, some of whom I know are very aware of what an issue this is for their constituents. They're also aware that the clock is ticking. Some Republicans in Congress keep saying, let's wait. We have time to deal with this later. Unfortunately, we now know that there is a cost to waiting. Just yesterday, the CBO, the Congressional Budget Office, estimated that if we don't act, if we wait until the end of the year to pass an extension, that 1.5 million more people will go uninsured. Premiums will still go up, and waiting actually costs the federal government an additional $10 billion. So for all of our colleagues on the other side of the aisle who were so anxious to cut different aspects of our government because they want to fund their tax decrease for the wealthiest in this country, they ought to care about an additional $10 billion that it's going to cost if we wait to address this issue. Waiting to act is going to leave more Americans uninsured. It's going to cost patients more for their hard-earned income, and it's going to be more expensive for the federal government. So while I'm encouraged by some of the public reporting that several of our Republican colleagues are interested in extending the ACA enhanced premium tax credits, the time for us to act is now. The president's own pollsters have warned that not extending these tax credits would be a political catastrophe for the GOP. I would hope that we could all agree that addressing the affordability crisis that Americans are facing because of the increasing costs of everything from groceries to rent to electricity, those shouldn't be partisan issues. I know there are many of our colleagues on the other side of the aisle who understand these stakes, who are worried about what's happening with their constituents. So let's come together. Let's address the American people's concerns. Let's put aside the politics and work to keep health care premiums affordable. Let's support the small business owners who power local economies all across the country and create 2/3 of the jobs in America. Let's preserve this vital program that keeps Americans healthy and safe. Thank you, Mr. President. I yield the floor.
Thank you, Mr. President.
I recognize the senator from Vermont.
Thank you very much. And I thank my colleague, the senior senator from New Hampshire. You know, I really appreciate her very practical presentation about a common concern that we have, Republicans and Democrats, and that is that we do no harm when it comes to the profound insecurity people are feeling about having access to health care for themselves, for their partners, for their kids. And, you know, we've got real differences in this chamber, little introductory remarks about the one big, beautiful bill. You know, I do think it's a terrible bill. I do think that we've taken money from health care and other areas to fund a tax cut for very wealthy people. I think it's bad for the economy and creates a lot of insecurity. We're also having a big battle about the funding of government, which is a responsibility that we all have. And I want to be candid. I take significant issue with the president when he says, don't even bother dealing with Democrats. This always is a budget issue that has to involve Democrats and it has to involve Republicans. If we don't talk, we don't resolve differences, and we're not even in a position to do our job and find common ground. So we're in a pickle. That creates some hard feelings as we try to work through this. And I don't want to dwell on that because we do have different points of view on that. But we've got a situation here, as the senior senator from New Hampshire described, where if these health care premium supports expire, every American who has come to depend on access to health care through Obamacare, which is now accepted as an important element in our health care system, every person on that is in incredible jeopardy. And I know that every single member of this Senate is very concerned about access to health care for the people they represent. There's no alternative for folks out there that is even being discussed if we don't continue the premium support for people who are getting their health care through the Affordable Care Act. So I want to focus on this as the senator did. I don't want to focus on the partisan differences. I want to focus on the concrete reality that a family is going to face if the Affordable Care credits expire. Number one, as Senator Shaheen said, this can't wait. The date is going to arrive, the tax credits expire, people who are depending on that health care won't have it. 24 million Americans will face higher costs. And again, I want to emphasize, that's not 24 million Democratic families. That's not 24 million Republican families. It's 24 million families. It's in both our states. It's not political. It's about health care, which every single citizen, we want them to have it and have it be affordable. Premiums are going to increase on average about 75%, as the senator said. 1 in 4 people who have a chronic condition are going to lose out on coverage. 3.3 million small business owners will see their premiums increase. And I just want to stop on that point for a moment, because the senator, my colleague here, has done so much for small business, and that's because she knows, as I do and I know as you do, Mr. President, that small businesses are so vital to the well-being of our community. And one of the things I've learned from my visits to small businesses is really pretty inspiring, because I see those Vermont small business owners, their employees are like family to them. The most important thing to them is to make sure that their employees are doing well. One of the things that is really important to our employers is that they can provide health care. But with the premiums going up like this, it's a wicked decision and discussion between the business owner and the employees about a raise versus picking up the high cost of a premium increase. That's going to be aggravated if these tax credits expire. 1.6 million of those folks in small businesses would lose coverage. Again, I want to make this concrete now. You know, in Vermont, 27,000 people who rely on the tax credits will lose their health insurance. They just won't be able to afford it. Let me give you a couple of examples of the real world here in Vermont. The annual premium increase for a 60-year-old couple in Vermont that earns $82,000 a year. And that's tough to get by if you have a family on that amount of money. But the premium increase is going to be $23,000. That's a fact. That's a 335% increase. But that's like $2,000 a month. So what that says to that family is you're on your own. No health care. In Nebraska, 112,000 folks rely on the Affordable Care monthly premium tax credits. The annual premium increase for a Nebraska family, a 60-year-old couple that are earning $82,000, $83,000 a year, $23,000, pretty much the same as Vermont. In California, there's 1.5 million folks relying on the ACA premium tax credit. That 60-year-old couple making $82,000, it's going to be an additional $17,000. In Connecticut, 112,000 folks are going to lose access to health care with these increases. That 60-year-old couple with $82,000 in income, a $28,000 premium increase, 541%. And in a lot...
Yield for a question.
I will.
I think one of the things that people don't understand, and I don't know if you agree with me, is that what's going on here is that as these costs go up and as it becomes harder for people to enroll in the Affordable Care Act marketplace because of other changes that were made in that big betrayal bill, that the risk pool, a lot of healthy people don't sign up again, and so the risk pool gets includes a lot more people who are sicker, who have illnesses, and as the insurance companies are looking at those projections, they're saying, well, we got to raise rates because if we don't, we're not going to be able to cover the people who need help, and that doesn't just affect those people who have those health insurance costs, but all of the rest of us are going to pay more for our health insurance too. Would you agree that that's part of what's going on? That's what we heard from the Georgetown University Center on Health Insurance Reform.
I'm so glad that you brought that up, because what drives everyone crazy is the so-called cost shift. And a lot of our community hospitals, they get under-reimbursed oftentimes on Medicare or Medicaid, and then the employer-sponsored premiums are the only place the providers can go to cover their legitimate cost. So there is a huge spike in the cost. And if you have all these folks without health care and they're showing up and getting free care, then somebody's got to pay, and that's going to be the employer-sponsored and the private pay. So the senator from New Hampshire is right in pointing out that we've got this broken system that we're making worse with this effort. So thank you so much for that, Senator from New Hampshire. But I wanted to go back to just these numbers, too. In Alaska, 23,000 folks, they can lose their health care, or they're going to have a premium increase, that family with $82,000, $800 income. It's $44,000. Okay? So that's a 554% increase. In Wyoming, 40,000 folks rely on the ACA tax credits. That 60-year-old couple with an $82,000 income, their premium is going up $37,000. That's $3,000 a month, okay? In West Virginia, 49,000 folks lose it. That 60-year-old couple, $82,000 income, $39,000 premium increase. $3,000 a month. You know, what we know is that can't happen. It cannot happen. You're literally, through passivity in this United States Senate, where we have the option to act or we have the option to hide. The second option is sending a direct premium increase to our families up to $40,000 in a year for people who make $80,000. So if this happens, this is on us. If this happens, it's on us.
Senator, yield for a question.
I will yield to the senator from Illinois.
I'd like to ask through the chair basic question to my friend from Vermont. You've been involved in politics a few years, so have I. I'm trying to understand if I were a Republican senator who voted for this kind of premium increase for people in my state, more than a handful, a lot of people in my state, how I would explain it. Do you know?
Well, if you're a billionaire, it works out, okay? The fact is, it can't be explained. It hasn't happened yet. This is about to go into effect if we don't act as a Senate. Yeah.
When you say it's just about to happen, is it the announcement of the premium or the actual imposition of the premium increase?
It's the actual imposition of the premium increase. The only way we can spare this heartache literally taking away people's health care is by extending those the premium tax credits. So that's a decision this body has to make.
So you used an example, through the chair, you used an example of Wyoming.
I did.
You say 60,000 people in Wyoming?
Let me get that number for you. Well, go ahead. I'll get it.
I was trying to figure out if someone's making $82,000 a year, I think that was your reference point,
Right.
and they qualified for the Affordable Care Act health insurance. They currently receive a subsidy to help for the payments based on their income.
That's right.
And you're saying the change in the big, beautiful Trump budget voted by our Republican colleagues is going to result in an increase in monthly premiums in Wyoming of the person making $82,000 a year of $3,000 a month?
That's right. $37,000 a year, and there are 40,000, as you mentioned. And this is really about the Affordable Care tax credits that expire. This was not in the Big Beautiful Bill. The Big Beautiful Bill took $1 trillion away from the Medicaid program. But now we have pending before us the imminent cliff where the premium increases that were passed by this body on a bipartisan basis to help during COVID, those expire. And when that expires, those families in Wyoming who are on the Affordable Care Act and who are 60 years old and they have 82 grand in income, they're going to see a premium increase of $37,193.
This is not a casual increase. This is for real.
That's a loaded gun, you know, at the heart of the family and their ability to carry on. I mean, this just can't happen. It can't happen. And we're the body that has the option of ignoring the hardship and catastrophic consequences of this on the families we represent, or sparing them and allowing them to continue having access to health care that they depend on.
Well, let me just ask you this question. Since we have the continuing resolution being considered, which would go in effect September 30th if we agree on one, if it took care of this tax credit issue, you could spare that family in Wyoming from a $3,000 a month addition to their hospitalization premium. Is that correct?
That's exactly right. That's exactly right. And that's within the power. This is the wonderful thing about those of us who have this job. We have the power to do something that can help the people we represent. They need health care. Republican families need it. Democratic families need it. People who don't care anything about the political process, they need it. And you know what? In our country, they should be entitled to it. We can act. And it's not a partisan thing. It's not a victory for one side or the other. It's really a lifesaver for these families, the Wyoming families, the Vermont families, the Illinois families. So I urge this body to come together to do something that the people we represent, every single one of them, needs and would benefit by.
So let me ask the senator from Vermont his own personal experience. Mine was that last year I decided to replace my knee, my football knee from high school, and my hip the same year. I started receiving these projected bills and how much I might personally own if I didn't have any health insurance. We're talking about thousands and thousands of dollars. Now, these were basically elective surgeries, but much more than the average person has available on hand to pay a bill. Imagine if instead of that elective surgery, I had, God forbid, broken my leg, ended up in the emergency room and needed help with surgery when it was all over. The net result of it is a bill which most families would struggle to pay if they had no health insurance protection.
Right.
This seems like the reality of the situation. It's your money or your life is the Republican proposal. We're either going to have you pay $3,000 or more a month in premiums, or you're going to have to gut it out and hope that you don't get sick or don't have an accident that could cost thousands and thousands of dollars.
Well, you know, you're exactly right, because that family, making $82,000 a year, and they're struggling to pay the premium as it is. If they have to pay $3,000 more a month, most of those families are going to say they'd like to, but they can't, okay? And they're going to be uninsured. And I'll give a story of my own. My first wife died of cancer, Senator. She had cancer for 9 years. We had terrific health care. She had a rare form of cancer. One night, my car broke down, and the wrecker guy picked me up, and we had a long ride. We got to talking. It turned out that his wife, and he had 2 kids, younger kids, had the same form of rare cancer, and his wife died. And we talked about that. But there was a difference. We had insurance through the University of Vermont, where my wife was a professor. He had no insurance. He was working late at night, long hours, raising these 2 kids by himself, and he was trying to pay off a $335,000 medical bill. That's not right. But that example you just mentioned of this Wyoming family or a Vermont family or an Illinois family, where they're faced with $3,000 a month, they don't have the money, they go without health care, somebody gets sick, they have a serious illness, they get medical debt. They get anxiety. Anxiety on top of the anxiety that always accompanies a serious illness in a family, where all of your attention, if it's your partner, if it's your child, is about your partner and child. And then on top of that, you have that incredible stress of bill collectors calling up, where's the money? We don't have to allow this to happen. We don't, and we shouldn't. And I just want to emphasize, it's not a Republican-Democratic deal. It's a mutual responsibility that this United States Senator has to the people of this country, in your state and in my state. So, Mr. President, I urge us to get a solution. And I talked about West Virginia, your great state, where folks will face enormously high premium increases if these Affordable Care Act subsidies expire. It'd be brutal. You know, I told you about my visit to West Virginia, my respect for those coal miners and the hardworking folks there, and I know, Mr. President, how highly important it is to you about health care access. So let's act as a body. Let's do it together and make certain that folks do have health care and don't just have the insecurity, the anxiety, and the bills that are just going to cripple them. I want to thank the senator from Illinois. I want to thank my colleagues in the Senate, and I will yield back, or yield to the senator.
I thank the senator from Vermont as well as the senator from New Hampshire for organizing this floor block. I'm going to submit my comments for the record and just say that the people who have contacted me from Illinois are scared to death about what's going to happen October 1st. This big, beautiful budget bill of President Donald Trump, unfortunately, is not going to extend the tax credits available to reduce premium costs. Families are asking me, how in the world, Senator, are we supposed to pay these increased costs of thousands of dollars each month? I don't have an answer for them, but the Senate has an answer. The Senate can change that. We can restore this tax credit. There are a lot of priorities for a lot of people, but I'll tell you, if you've ever lived without health insurance, you understand it is a basic priority. You never know tomorrow what you're going to end up paying in a medical bill. And if you aren't prepared for it, it can wipe out your savings in no time flat. So I'm going to submit my comments for the record. I know it's 6 o'clock and we've had a long day in the Senate, But I just want to thank my colleagues from Vermont and New Hampshire for organizing this floor block. I yield the floor.
Mr. President.
The senator from Ohio.
Mr. President, I ask unanimous consent that notwithstanding Rule 22, at a time to be determined by the majority leader following consultation with the Democrat leader, no later than Friday, October 10th, S.J. Res. 71 be discharged from the Committee on Energy and Natural Resources and that the Senate proceed to its consideration. Further, that there be 6 hours for debate only, with the time equally divided between the leaders or their designees on the joint resolution, and that following the use or yielding back of that time, the joint resolution be read a third time and a Senate vote on the resolution. I ask unanimous consent.
Without objection.
Sorry about that. I ask unanimous consent that the Senate proceed to legislative session and be in a period of morning business, with senators permitted to speak therein for up to 10 minutes each.
Without objection.
Mr. President, I have 12 requests for committees to meet during today's session of the Senate. They have the approval of the majority and the minority leaders.
Duly noted.
I ask unanimous consent the Senate proceed to the consideration of Res. 400, which was submitted earlier today.
The clerk will report.
Senate Resolution 400, expressing support for designation of the week of September 14th through 20th, 2025 as National Adult Education and Family Literacy Week.
Is there objection to proceeding to the measure? Without objection, the Senate will proceed to the measure.
I ask unanimous consent that the resolution be agreed to, the preamble be agreed to, and that the motions to reconsider be considered made and laid upon the table with no intervening action or debate.
Is there objection? Without objection.
I ask unanimous consent that when the Senate completes its business today, it stand in recess until 10 a.m. on Thursday, September 18th, that following the prayer and pledge, the Journal of Proceedings be approved to date, and the time for the two leaders be reserved for their use later in the day. Further, following leader remarks, the Senate proceed to executive session and resume consideration of the nominations in block pursuant to Res. 377. Finally, that all time during recess and leader remarks count post-cloture on the nominations in block.
Without objection.
If there's no further business to come before the Senate, I ask that it stand in recess under the previous order following the remarks of my Democrat colleagues.
Without objection.
Mr. President,
The senator from Wisconsin.
folks in this chamber may know this, but the fight for affordable health care is deeply personal to me. When I was just 9 years old, I had a very serious childhood illness. It was a diagnosis similar to spinal meningitis. That wasn't the exact diagnosis, but I was actually in the hospital for 3 months. And even though I made a full recovery, my family was not able to find health insurance for me at any price. And that's because I had been labeled as a child with a pre-existing health condition. At that time, insurance companies were allowed to refuse coverage for people because they had pre-existing health conditions. But because of the Affordable Care Act, we changed that and gave Americans with pre-existing conditions some serious protections. We gave families like mine hope. We gave young people hope, allowing them to stay on their parents' health insurance until age 26, a provision I crafted in the House of Representatives. And we gave small business owners hope, ensuring that their employees could get affordable care. And since then, I'm proud to say that we've actually built on the success of the Affordable Care Act. One of those wins has been giving families a tax break when they buy their insurance through the marketplace to help make their health care more affordable. For small businesses like our restaurants, manufacturers, and child care providers, The small group health insurance market isn't just a huge administrative burden, it's also expensive. The open marketplace is the difference between being able to hire and retain and keep doors open and losing staff to jobs at companies that have the wherewithal to provide health insurance. But this tax break is all on the line right now. If Republicans don't act with us, this tax break will end at the end of this year, jacking up premium costs for 24 million people in America, including pricing about 4 million Americans out of the market altogether. Yes, you heard me right, 4 or more million people will see their health care terminated. These numbers have very real people behind each of them, with very real stories. Take Amanda. Amanda is a broker's assistant in a real estate office in Wisconsin who relies on the enhanced premium tax credits on the Affordable Care Act. Amanda, who has lupus, needs weekly shots to manage the autoimmune disease. Or take Madison. She's a chef and restaurant owner. Take Evan Daniels, who is a restaurant owner and chef who has about 12 employees who all get their care from the Affordable Care Act. He said that if that weren't an affordable option, his employees would be looking at corporate employers that can afford big insurance packages. The stories go on and on of Wisconsinites who rely on the Affordable Care Act to get just that, affordable health care. But these are the people who will have their premiums skyrocketing, forcing some, like Amanda, to lose care altogether, and forcing others, like Evan, to lose employees. The upside is that there's a very simple way to fix this, and it's right in front of us. Pass the bill that Senator Shaheen and I lead to make these tax breaks permanent. Time is of the essence. Families and businesses are going to get those dreaded letters in the mail any day now, saying their premiums are going up 75%. Families will have to make really tough choices. Small businesses will be left holding the bag as employees leave for corporations that are able to afford insurance plans. So we are left with one question. Will Republicans refuse to act and increase health care costs for tens of millions of Americans? So far, their answer has been yes. They have had opportunity after opportunity. In fact, 3 different times on the Senate floor this year. But again, they chose not to do anything. When Republicans were putting together their huge, sweeping tax bill, you would think that including tax breaks for tens of millions of families to afford health care would be their centerpiece, right? Wrong. As families are slated to get notices of how much their premiums are going to go up any day now, Republicans had yet another chance this week to help address this pressing issue. House Republicans unveiled a bill just yesterday to fund the government, but it does absolutely nothing to lower health care costs or prevent millions from being kicked off of their insurance. This agenda to strip health care from millions and raise health care costs for tens of millions is not what the American people are clamoring for, I can assure you. Wisconsinites have been crystal clear that they need lower costs. The last thing they need is their health care premiums to be jacked up or worse, not even being able to afford them. If Republicans fail to act, Wisconsinites know who to thank when their premiums go up next year and millions are priced out of health care. I yield back.
Oh, the senator from Washington.
Mr. President, thank you. I appreciate my colleague from Wisconsin talking about her own healthcare experience and why those in Wisconsin want to see us take action to help keep insurance affordable. I rise today because Americans are facing a massive wave of healthcare costs. Those increases are swamping the family budget, and they are hurting our healthcare system by increasing uncompensated care. But before I did that, I wanted to make a comment on today's Help Committee hearing with the former CDC Director Susan Monarez, who was fired by Secretary of Health and Human Services Robert F. Kennedy because she refused to rubber stamp what he wanted to have happen. Dr. Monarez basically confirmed what we already knew today, and that was that instead of basing vaccines on hundreds of years of science, instead, the Secretary of Health is trying to replace that with a pseudoscience. He's basically trying to say instead of 100 years of evidence about vaccines for measles and other childhood diseases, that now a new group is going to come up with recommendations and thereby, I think, confusing people. So I'm glad that the West Coast Alliance of scientists today put out a statement talking about what is the science that has been the basis for the United States for several years. Those are important things to understand, but this is an assault on our healthcare system if we don't continue to follow science in the most specific ways. So I appreciate Dr. Monarez basically coming before the Senate today, making sure that people understand that she was fired because she didn't want to go along with this. And I think that she made some important statements today about saying that we need to base science on evidence and not ideology. I agree with that. And I think people in the Northwest want to see this alliance in our state and in California and Oregon continue to advocate for good science when it comes to vaccines. But I wanted to also talk tonight about our healthcare system and the assault on it. Last week, the Washington State Office of Insurance Commissioner approved a 21% increase in the 2026 ACA marketplace insurance premium. So what does that mean? It means that our state said that insurance rates could go up. Why are they saying they could go up? Because this is the largest single increase since 2018, nearly double last year's increase. And why are they saying this? Well, they're saying this, insurers in Washington, because they're pointing to a couple of things: the Trump tariffs, the rising cost of the delivery system, and most importantly, the failure of our colleagues to extend the tax credits that would make health insurance more affordable for about 22 million Americans. In our state, 80,000 Washingtonians are expected to drop their health insurance coverage because they will no longer be able to afford it. That's a tragedy because we don't want to see people losing health insurance, because when they do, it means that there's just a lot more uncompensated care, and it means the cost of health insurance goes up for everybody. For everyone else, they will pay an average $129 more per month or $1,548 per year just to keep the same health insurance plan. So how did we get here? Why are Americans facing this looming threat? When the Affordable Care Act passed in 2010, the health insurance through Medicaid, the marketplace exchange was now available to millions of Americans. By making coverage affordable year after year, we saw more and more people covered by insurance. The rate of those uninsured in the United States dropped from 15% before the ACA to an all-time low of over 7% in 2023. So we basically cut that in half. We cut the number of uninsured in half. We could have done more, in my opinion. There were a couple of things we left on the table, and lowered that uninsured rate even more significantly. But today, 44 million Americans get their health insurance through the ACA. That's about 1 in 6 people under the age of 65. In our state, it provides coverage for an additional 626,000 Medicaid recipients and nearly 300,000 beneficiaries on the exchange. In 2023, the uninsured rate in our state was just 4.8%. So that means people are covered, you don't have uncompensated care, you don't have emergency room visits, you don't have the problems that we are seeing. So what happens now, though, is that millions of Americans, as I said, are now facing these skyrocketing costs of health care. And that is because data shows when more people have health insurance and our providers spend less on compensated care, the system is more affordable. But according to a Kaiser Foundation, aggregated uncompensated care dropped by $20 billion in the 7 years after the Affordable Care Act passed, but the tax credits that help make coverage affordable for those who need it the most are essential to driving down the cost for everyone. So if you don't keep the tax credits, we are now going to face skyrocketing healthcare costs unless we extend those subsidies. That's the point. We did a good job. We lowered uncompensated care. We lowered the cost of insurance. And instead, now we're facing basically the end of subsidies that we're now going to make that go up and cost all of us. As I mentioned, I've spoken to many of my constituents. One, I just spoke to Leslie, who has a connection to Three Rivers Hospital in Brewster, Washington. She told me that her husband relies on the ACA premium credits to afford his marketplace insurance. Without the subsidy, his monthly premium would increase from $200 to $700 a month, and he will no longer be able to afford his insurance next year. He also needs to have surgery soon, so they're trying to figure out how to get that done fast. And Leslie and her husband run a small business. They don't have the luxury of waiting and paying more just to get basic health care in a very rural part of our state. She understands the health care system, and she knows that we need to fix this. So she's calling on all of us to step up and get a certainty to the ACA tax credit. I'm worried about the additional 80,000 Washingtonians who are expected to lose access to checkups and preventive care. We know that people without health care insurance wait to get care until their condition worsens to a point where they end up in the emergency room. That costs them and everyone else more. And more people will also end up in the emergency department just because they can't afford preventive care or regular services. Treating a patient in the ER can be 10 times more expensive than treating a patient in a normal doctor's office. And these are costs that are being passed along in the form of higher health care premiums for all of Washingtonians, no matter what type of health insurance they get. So these Republican policies making it harder for us to hold down health care costs should stop. According to the Bureau of Labor Statistics, the cost of health care system has already risen 4.2% in the last 6 months, much higher than the rate of inflation. So we see that these costs, compared to other costs in our system, obviously energy costs are rising. But in addition to the cost of food and household essentials, Americans are facing these higher bills in general. I think the Trump administration is ignoring these real-life impacts on families. Congress should be working together to make health care less expensive. And we know that the Congress in the Republican-passed bill also created a lot of uncertainty as to the Medicaid marketplace and what's happening. And we already met with hospitals today from our rural parts of Washington who are saying they are seeing the impacts already of that bill on individuals not having certainty, or in one instance, basically, hospital needed to have some construction work done, and the person who was supposed to provide the construction and the financing of that said, are you really going to have the money to even do this? So it's sending a ripple through the entire system. So we can't afford to go back to a situation we had before the Affordable Care Act when 1 of every 7 Americans didn't have health insurance. We can't afford the wave of uncompensated care costs that'll hit hospitals and eventually all of us, and we can't afford the loss of lives and the medical bills that people are seeing every day. And we need Americans to understand that we should be listening to what you're saying. 72% of Americans say they want an enhanced premium tax credit extension. That is those who are strongly in favor and those who strongly in favor and somewhat in favor. That is what the American people are telling us. They want this health care to continue, just like they want their Medicaid coverage to continue. So let's do our jobs. Let's quickly act to extend the ACA tax credits. Let's do everything we can to make health insurance more affordable. Let's make a bipartisan effort to show the American people that we hear them, that a very big percentage of them want more affordable health care now for all Americans. Let's get it done. I thank the President, and I yield the floor.
Under the previous order, the Senate stands in recess until 10 a.m. tomorrow. The Senator from Michigan.
Thank you. Thank you, Mr. President. I rise today to talk about a very simple idea that in the most powerful country in the world, every American should have access to health care they can afford. Protecting Michiganders' health care is why I ran for the House originally. It's why I'm here in the Senate. I frankly never thought I'd run for political office. But in 2017, I watched on CNN as my then representative smiled and cheered in the Rose Garden as President Trump repealed the Affordable Care Act in the U.S. House. I looked at my TV screen and I said, no, you don't get to do that. You don't get to ignore your constituents, vote against their interests, and keep your job. I'm a former CIA officer, served alongside the military. In the military, they have a term for this. It is called dereliction of duty. It's a fireable offense. I ran that year to fire him, and in 2018, we did just that. This issue has particular salience for me because of my mom. My mom passed away in 2011 from ovarian cancer, and she had survived breast cancer many, many years ago when I was a little girl, so she had that pre-existing condition for the rest of her life. She lost her job, she had financial issues, she couldn't afford the insurance that was on offer to her, and walked into an emergency room and was diagnosed with stage 4 ovarian cancer. It was like a grenade went off in our lives. It's something I would not wish upon my worst enemy. I took a leave of absence, I came home to Michigan, and at the same time that she was fighting for her life to get, tests and emergency surgery, it was the same moment that we were fighting the insurance company so that she could get care. She fought hard for 18 months, but she passed away in 2011. And that experience drives the work that I did in the House and certainly why I'm here on this floor today. Sadly, we're nearly a decade after that original attempt by President Trump to repeal the ACA. And we're in a similar place. President Trump and my Republican colleagues are doing everything in their power to cut health care for average Americans. They're just doing it in different and creative ways because they know it's politically unpopular to tell you to your face. We're coming up on a big deadline here. We all know that September 30th, the government runs out of money. I don't know a single person who wants a government shutdown. After almost 16 years in the federal government, where I was on the receiving end of those shutdowns, I do not want our government to run out of money. But if my Republican colleagues want my vote on that bill, they're going to need to act like adults and come talk to me about it. And what I'll say to the state that I'm representing, as well as to my colleagues, is that if you want that vote, you're going to have to talk to me about health care. That's the place to start. If we roll the tape back just a couple of months ago, the president and my colleagues voted on the Big Beautiful Bill. The Big Beautiful Bill did important things to change the face of health care in the United States, and we're only now just starting to feel the effects. So if you want my vote next week or in the next couple of weeks, we're going to have to talk about the significant Medicaid cuts that you made, the ending of a bunch of subsidies for the marketplace or Obamacare, and talk to me about putting money back into things like cancer research that you slashed. Because there's few things as fundamental as providing health care to your family, and yet there are few systems in America that are as broken as health care in America. I don't know a single person who thinks that our health care system is working well. Do you know a single person who thinks they're paying too little for health care? And then on top of that, we don't even get the health outcomes that they get in other countries. And now President Trump has made these cuts even worse. As I mentioned, in the big, beautiful bill, they did two really important things. They cut Medicaid and they cut the subsidies for Obamacare. Why did they do that? That was the math that they needed in order to pay for permanent tax cuts for the very wealthy, right? They didn't want to say that out loud, that in order to pay for those tax cuts for the very wealthy, those permanent tax cuts, they had to cut health care in America. They had to, in order to make the math work. But we know that those kinds of cuts could potentially shutter hospitals, particularly in the rural parts of my state. Community health centers could close. Every hospital I have talked to is talking about which services are they going to have to cut, particularly things like birth and delivery services. You're going to have communities that have to drive 30, 40, 50 miles just to have a baby or to make it to the ER. And now Michiganders on the other side of the ledger, those who have private insurance, are starting to feel the heat. Because if you cut those other programs, right, if you cut Medicaid and Obamacare, and maybe you say to yourself, well, I'm not on Medicaid. Well, I'm not on the marketplace. I don't have Obamacare. The healthcare companies have already started, for their private insurance, increasing the rates starting January 1. They're starting to send out letters, right, like this one I have in front of me. This was sent to a man in Macomb County, Sterling Heights. I met him this past weekend. I said, I'm really concerned that private employer-provided health care is going to go up starting January 1st. He's like, I already have gotten my letter, right? He said, his letter here says, last year, the cost of your health care program in total was $36,969, so almost $37,000. Starting January 1, if you want to continue this program, it's $43,000. That's happening across the state of Michigan already. So if you thought that the big, beautiful bill was cutting someone else's health care, that cost, which is so personal to so many people, because it's whether we can provide health to our loved ones, is now going to go up. So every single American is either at risk of losing their health insurance or having the price of their health insurance go up. Other Michiganders are going to see an even bigger price hikes than those who are in private insurance, especially if they're one of the 500,000 Michiganders who get their coverage through the ACA marketplace or Obamacare. Open season is this November 1st, so they're going to start to feel that pain immediately. We're hearing stories of people who are going to get a 79% increase in their bill starting January 1st. And I had the head of a big Michigan private insurance company come in today. She was telling me that other insurers have just decided to get out of the business of providing health care plans for people on the marketplace. So you're going to have fewer choices. Companies like HAP, Molina, and Meridian have already decided that because of the bill that President Trump pushed for in July, they are no longer going to be offering plans through the Obamacare marketplace. So less choice, higher prices. Just to put this in perspective, here's an example of what President Trump and my Republican colleagues have brought to working Americans. A family of four making $129,000 a year, got 2 kids. If they're on a marketplace plan, they're going to see their health care plan go up by $5,000 next year, starting January 1. That's how much they'll pay just for the increase. And a 6-year-old couple, 2 elderly folks or 6-year-old folks, not elderly, living on about $85,000 a year. They're empty nesters. Their kids have left home. They will see their premiums go up by over $10,000 next year. Now, what do you do? If you're 60 years old, there's 2 of you, your plan was already expensive, now you have another $10,000 on top of that. You know that those people are thinking to themselves, you know what, I'm just going to go without insurance. I can't, he's raising my bills in every single category, and so I'm just going to take the risk. I'm going to go without health insurance and hope that I don't get into a car crash or into a major accident. President Trump literally campaigned on lowering your costs. That was what this election was about. He said that he was going to put more money in your pocket. Can anyone name a single place, if you're a working American, where your costs have gone down and not up since January of this year? And many Michiganders are going to end up in the position that my mom was in. Walking into an ER, getting that diagnosis, your brother, your mother, your child needing care, and having to choose between bankruptcy and getting some sort of care for that terminal illness. Now, we can't end the fight there. I'm willing to negotiate with my colleagues. I know that plenty of my colleagues on the other side of the aisle think that it is absolutely insane to raise the price of health care, that they don't want to be associated with that. There's so many people who feel that we have people retiring on the other side of the aisle. But the only way that we move the needle is if we get loud about it. It's exactly what happened in 2017. Why is it that cutting health care was President Trump's signature campaign goal in 2017 or in 2016, why he talked about it obsessively every day in 2017, while the House of Representatives on the other side of this building did repeal Obamacare, but we still have it today. Why is it? It's because the public said no. The public said, you're not going to take away my health care, my protections for pre-existing conditions, and get away with it. And the public turned so hard against the Republicans on that issue that in this body, on this floor, John McCain cast the deciding vote, thumbs down, on repealing Obamacare. That is why we have it today, because the bravery of that man. And I wish and pray for the bravery of someone like John McCain to be back in this body on the other side of the aisle, who has the ability to say, no matter what my party, I'm not going to charge Americans more for their health care. President Trump has done the opposite of that. If you want to understand what happens when you get your letter, and they're all coming, October for Michiganders is when we understand the plans are sending out their letters. When you get that letter and you gasp at how your price has gone up on your private insurance, your employer-provided health care, you understand exactly who gave you that price increase. Exactly who put you in that position, exactly who told you that he was going to lower your costs, and now you are going to have to eat that cost starting January 1st. That is Donald Trump. That is my Republican colleagues who sit across the aisle. That is everyone who said, I'm going to do the political thing instead of what's right for the average American. Healthcare is something that this country should be providing to its citizens so that everyone can afford. That's just a basic thing we should do as the most powerful nation in the world. And all I'd ask my colleagues across the aisle, especially as we hit this September 30th deadline, is ask yourself, what would John McCain do? What would John McCain have done on the big, beautiful bill? And what would he do if he had the chance to restore people's health care and he had that moment on the Senate floor? Please, grow some spine and help your constituents. Let's have a conversation about health care. Thank you, and I yield back, Mr. President.
Mr. President.
The senator from Minnesota.
Mr. President, I join my colleague from Michigan, as well as Senators Welch and Shaheen and the others that come before this body today to talk about what's really happening out there. Well, what's really happening out there is that we are in a healthcare crisis. And that is because the big, beautiful betrayal of a bill will kick 15 million Americans off their health care, force hospitals, health clinics, and nursing homes to close. And as is already happening with the premium notices, with what they're already seeing, it is raising costs for everyday Americans. And now, if Congress doesn't act to extend the Affordable Care Act's health care tax credits before they expire, more than 20 million Americans will see their premiums soar, putting their coverage at risk. I go to all 87 counties in my state every single year, and I visit rural hospitals. I know what's happening out there. I know what's happening to people who are in small businesses, who rely on the Affordable Care Act, who are already seeing increased grocery costs, are already seeing increased electricity costs, and are already seeing dried up markets because of these tariffs. This is all hitting them at once. At the end of the day, everything from regular checkups and life-saving prescriptions to hospital visits and long-term care is under threat. Not for the wealthiest, they're going to be able to handle it. Maybe not even for people in some of the big cities. But for people out there in rural right now, they're barely holding on as it is. And this is on top of the funding cuts to public health and medical research that extinguish hope for life-saving cures and jeopardize America's global leadership in medical innovation. Those people are holding on too. Just last weekend, I went with the Parkinson's Association on their charity walk. Those people are holding on for hope. In their wheelchairs, they're holding on for hope. Their daughters and sons, their brothers and sisters. And we are so close in so many areas because of the mapping of the human genome, because of AI, as this is coming from the home of the Mayo Clinic, Minnesota, that we do not want to go backwards when it comes to investment in research. That's why my Democratic colleagues and I are fighting to restore health care in this upcoming budget bill. Right now, healthcare access for more than 20 million Americans who benefit from healthcare tax credits are at risk, as I just noted. And as a result, a record number of Americans, 24 million people, have been enrolled in this Affordable Care Act, but all of them are going to see this increase if something isn't done. This will be a massive hit to working families. It will be especially harmful to middle-class families, small business owners and entrepreneurs, seniors, and people living in rural communities. It will force states to reduce coverage and shift resources away from other priorities like education and public safety. In Minnesota, at least 9 rural hospitals are at immediate risk of having to shut their doors and stop providing care. Medicare, Medicaid, and enhanced health care tax credits are overwhelmingly supported by Americans. Why? Because this is about their families. This is about the fact that they know that health care over the years, they've seen the prices, what's happened, they've seen what's happened with pharmaceuticals, and they expect us to do better than what's happening now. They expect us to do better than putting forward this bill that just happened that hurts their rural hospitals, or throw people off of their coverage, or stop life-saving research on these cures that has always been so bipartisan, or the rhetoric around vaccines, which so many of them know their kids need. I just found out this year I had no immunity to measles because I had that shot, but it was at the wrong time, so I got that vaccine. But right now, so many people don't even know when they turn on the TV and they hear the HHS secretary question these vaccines against the belief of a number of people on the other side of the aisle, the senators, Republican senators, including those who are doctors. This is just creating massive chaos. Costs are up, chaos is up, confusion is up. We must do better. More insured Americans is good for patients, good for families, and good for our country. More research paves the way for cutting-edge treatments and the cures of tomorrow. Mr. President, I yield the floor. Thank you.
Under the previous order, the Senate stands in recess until 10 a.m. tomorrow.